Hello, and thank you for clicking on this brief video excerpt of an interview I recently conducted with Dr. Stephen Call from Washington State University. This particular clip talks about salaries and salary surveys, and I just wanted to introduce it because from our perspective in the recruiting world, what Steve talks about relative to salary surveys and the weakness in salary surveys is what we see really throughout the country on our recruiting projects. Steve will talk about the weakness in doing hospital-to-hospital salary comparisons, meaning St. Joseph's Hospital in Providence is doing a salary survey with Women and Infants Hospital in Providence, and they're looking at the salaries. But they're looking at hospital salaries, and they're not looking at other industries who are also looking for facility management professionals. I find, as I talk to candidates and people who work in healthcare facilities management, it is a frustration for them when they are not even looking for a job. Say they're trying to get a little bit more of a salary. They're not necessarily looking to leave, but they're trying to get their organization to do a salary survey because they know they can probably get more on the open market. So while they don't want to leave, they would like an adjustment. Now we can talk about whether or not that's fair. That's a different issue, but we find that there is a major source of frustration for a lot of employees because their hospitals are often just doing hospital-to-hospital salary comparison. And in this particular episode and in this particular clip with Steve, he talks a lot about salaries and how healthcare lags behind other fields in starting salaries. So I just wanted to, use this brief introduction, because you're going to hear Steve talking about these salary surveys, and just to reiterate that what he discusses here, we certainly see it across the country, and I think it's something that really does need to be addressed. Where we're just, on a salary survey, we're looking hospital to hospital, yet we know pharmaceutical, academia, manufacturing, they're also hiring people, and that's driving salaries up. And so with that, let's click over and let's listen to what Steve Call says about salary surveys.
I'll say maybe it was a year and a half ago or so, there was a very large research project sponsored by the International Facility Management Association looking at salaries, facility management salaries across the globe. So geographically spread, but also we looked at the data specific to different industries. So the primary industries hiring facility managers are really government entities, education, healthcare, and then you'll just kind of general corporate type environment. And what I found really interesting is as we looked at, as we separated out those that salary data, and we looked at different levels too, right? We had a level 1 through a level 5. Level 5 being kind of the executive level, senior level role. Level 1 more of an entry level. So we kind of broke that by job levels. So entry, mid, senior level is really what that categorized as. When we looked at those different levels, healthcare, interestingly enough, was paying significantly below market compared to other industries. And now that was just specific to entry level and mid level. Once you got to a senior level role within healthcare, it was equal compared to other industries. So I think what's happening a lot of times is healthcare organizations, the HR teams out there comparing salaries to other healthcare organizations.
Yeah.
And so they're saying, well, hey, a lot of times the director is saying we're having a hard time finding people, we're not paying competitively, and they're saying, well, sorry, our banding seems to be matching other healthcare organizations, but the real competitor isn't necessarily the hospital down the road. It's other organizations that are trying to recruit for facility managers. So that's when you say what do I find interesting, I think that's a really important thing that the facility leaders can now be armed with to say, well, time out. I get that you're comparing yourself to other hospitals, but we really should be comparing ourselves to other industries as well, because that's who we're competing against.